Now that we've covered epithelial tissue, muscle tissue, connective tissue, and nerve tissue, let's do a quick review. Again, under connective tissue, we had three main categories. We had connective tissue proper, supporting connective tissue, and fluid connective tissue. Under loose connective tissue, we had, under connective tissue proper, we had loose and dense. Loose was areolar, adipose, and reticular. And under dense, we had regular, irregular, and elastic. Under supporting, that's where we have cartilage and bone. Under bone, we focused a little bit more on compact bone, which was the osteon. And under cartilage, we spoke about hyaline cartilage, elastic, and fibrocartilage being the strongest. Hyaline cartilage being found at the end of our bones, creating articular cartilage, which can degenerate. When that hyaline cartilage degenerates, we call it degenerative joint disease, aka osteoarthritis. It is not the same thing as rheumatoid arthritis. Osteoarthritis or degenerative joint disease is typically known as a wear and tear disease, but rheumatoid arthritis is almost like an autoimmune condition. Fibrocartilage was the IVD, the intervertebral discs, the menisci, as well as the pubic symphysis. Hyaline cartilage, we'll talk about in a second, and remember, elastic was more flexible. The third type was blood, red blood cells and white blood cells, or erythrocytes and leukocytes. So the fluid connective tissue, if this was drag and drop, we would drop blood under fluid connective tissue. Hyaline cartilage, elastic cartilage, fibrocartilage, and compact bone, we would drag and drop under supporting. Areolar, adipose, and reticular, those were loose connective tissue for connective tissue proper, and then dense regular, dense irregular, and dense elastic was our dense connective tissue proper. Now is drag and drop under the four different categories, right? There's epithelial, connective, muscle, and nervous tissue. So if we were to say neuron or nervous tissue, again, that's the easiest one. Well, where does cardiac and smooth muscle fall under? That's muscle tissue. Where does simple squamous, stratified squamous, simple columnar, pseudostratified columnar, those are all epithelium. And then areolar, adipose, elastic, compact, and hyaline, those are under connective tissue. Nice, easy review. Under elastic, cartilage as a choice, hyaline cartilage, and fibrocartilage. Elastic cartilage, elastic, that's the flap. The epiglottis is the flap that closes your airway, so when you swallow food, you don't get food going down your windpipe. The helix of the ear, or the external ear, known as the pinna, and the eustachian tube. That's all elastic. Hyaline cartilage is the cartilage that is found at the end of your bones. They make up your joints. It's in the nose, your nasal septum. Your thyroid cartilage, also known as the Adam's apple. And then the tracheal rings, cartilage that goes around your windpipe, the trachea. Remember that fibrocartilage is made up of type 1 collagen fiber, and then hyaline cartilage is made up of type 2 collagen fibers. Fibrocartilage is the strongest, it's the thickest, so we're going to find them at the intervertebral discs, the pubic symphysis, and the menisci of the knee. Again, fibrocartilage, right there, type 1 collagen fiber, hyaline cartilage, type 2, just remember F comes before H, type 1, then type 2. And then elastic is the elastic fibers, elastic cartilage. Okay, when we come back, we will get into the skin, which is made up of the four types of connective tissue that we had spoken about.